Welcome to this video about double lumen tunnel cuff central line safety. In this video, you will find information about daily checks you need to make of your child's line, what to do if there's a problem with your child's line or if it is accidentally pulled out, and how to use your line safety pack. Throughout this video, we will refer to the patient as a child, but this will also apply to teenagers and young adults. We are going to demonstrate the safety aspects on our mannequin called chest to chest. After watching this video, you will understand the importance of checking your child's central line daily and how to get help for any issues. You will also understand what to do if the line is broken or gets pulled accidentally. Your child has had a double lumen tunneled cuffed central line inserted in theatre. This line can be used throughout your child's treatment for taking blood samples and giving medicines. The line has a tip which sits inside the body, an exit site where the line leaves the body, and two hubs which can be used by healthcare professionals for taking bloods or giving medications. The line is inserted into a vein in the neck and then moved along until it sits either in the top of the heart or a big vein just before this. You might notice some wound strips or a small scar on the neck where the line has been inserted into the vein. We call this the insertion site. The wound strips need to be kept dry for 48 hours after line insertion and then will come off naturally when they get wet. The other end of the line is tunnelled under the skin so that it leaves the body on the chest. Where it leaves the body is called the exit site. As this child has a double lumen line, the line then splits into two sides at a triangle ending in hubs, usually one white and one red. Both of these have a clamp on them and a needle-free access device on the end. You may also hear us call these smart sites or bungs, however we will call them needle-free access devices throughout this video. It is important that the dressing over the line stays on and remains clean and dry to help prevent the line being pulled or broken, and to help prevent infections. Dressings routinely need to be changed every 7 days, unless there is a problem before this. It is important to ensure that the dressing stays stuck to the body and intact all the way around. It is important that the exit site is in the centre of the dressing to help prevent infection. The triangle needs to either be under the dressing or secured with a special device called a stat lock. This is because this part of the line is heavy, so the line may be more likely to break if this is not secure. If the dressing starts to peel or it comes off, then you can secure it as much as you can with one of the spare dressings in your line safety pack and call your community team or local shared care centre to attend for a dressing change. It is also important to make sure the line is always in a loop or a wiggle, U or S shaped, under the dressing. This helps to make sure if the line is accidentally pulled, the loop or wiggle is pulled first, rather than the line directly. If this loop or wiggle comes out, make sure the line is secure with one of the spare dressings in the safety pack and contact your community team or local shared care centre for a dressing change as soon as possible. You need to make sure that the clamps on the lines remain closed at all times. If you find one is open, then close it and contact your community team or local shared care centre for advice. There should be a needle-free access device on the end of each line at all times, and these need to stay clean and dry. We will discuss what to do if one of these comes off shortly. It is important to look out for signs that the line may be infected. These include redness around or tracking above the exit site, oozing from the exit site, pain around or above the exit site, if it feels hot around the exit site, or if the child has a temperature. You should also check the insertion site on the neck for any of the same signs. If you notice any of these signs, you need to immediately let your community team or local shared care centre know. If you want to give your child a bath, you can do so, but you will need to try and keep the line dry. This is possible by filling the bath to waist height. To keep the end of the line dry, this can be put into a clean glove or a sandwich bag and secured with tape. It must then be taped up higher on the shoulder. This can all be removed after the wash. If the dressing gets wet, then contact your community team or local shared care hospital to arrange a dressing change as soon as possible. For children in nappies, it is important to keep the ends of the lines away from the nappy area. Tucking the line away in a baby grow or vest, or using a net vest or Surgifix is a good way of doing this, and also of ensuring they do not pull on or play with the line. If any wee or poo gets onto the end of the line, it is important to let your community team or local shared care centre know immediately. For older children, teenagers and young adults, crop tops can be a good way of keeping the line tucked away. When you go home, you will be given a line safety pack. This contains the following: 2 needle-free access devices, 2 blue clamps, a pack of gauze, a large dressing, 2 small transparent dressings, 4 cleaning wipes which have been provided by the hospital, such as Clinell wipes, wound strips, and medical tape. This pack needs to go everywhere with your child. If the line gets a hole in it or breaks, there's a risk of bleeding and infection. If you notice this, then you will need to apply the blue clamps to the line between the hole or the break and the exit site. You might need to take off some of the dressing to be able to do this, but try and make sure the exit site stays covered. To apply the clamps, take a piece of gauze, fold it in half, and then wrap around the line. Then put the clamp over this. Repeat this with the other clamp. Place one of the small dressings over the hole or break. If you need to secure the line further, you can use the large dressing or tape to secure the lines to the chest to prevent further damage. If the line is accidentally pulled or removed completely, you need to apply pressure. The pressure needs to be applied on the insertion site on your child's neck. If there is bleeding at the exit site, then you need to apply more pressure on the neck, or you may not be putting pressure on the correct site. You need to apply pressure for a minimum of 5 minutes and then look at the exit site. If there is still bleeding, continue to put pressure on the area for a further 5 minutes. Repeat this process until the bleeding has stopped. If this happens at home, then once the bleeding has stopped, attend your local shared care centre and make sure you take the line with you. If the bleeding continues or you are concerned, keep pressure and call 999. If the needle-free access device comes off the end of the line, then make sure the clamp is closed. Wash your hands for 30 seconds and dry them. Take the cleaning wipe from the pack and clean the hub for 15 seconds, then wait 30 seconds for it to dry. Open the new needle-free access device, take off the cap if necessary, and screw onto the end of the line. Be careful not to touch the tip of the needle-free access device or the end of the line, and make sure it is screwed on securely. Thank you for watching this video about your child's double lumen tunneled cuffed central line.